Hi, my name is Marisa Salisbury, and I'm going to talk to you today about the community assessment I did for Mason County, Michigan. So Mason County is in the northwest side of the Mitten. Michigan is divided into two locations, the Upper Peninsula, or UP, and the Lower Peninsula, or what we also call the Mitten. We are, if you were looking at your left hand, we are about where your top knuckle would be of your pinky, right on Lake Michigan. And we're a rather unique county because we're a rural county, but we're also the fourth most popular tourist destination in Michigan. And it's large in part to what you see here. This is the SS Badger, and it allows people to go between Ludington, Michigan and Manitowoc, Wisconsin. They actually see around 50,000 people that travel on the SS Badger per year, and around 1,000 commercial vehicles also travel on the SS Badger. Our Ludington State Park sees approximately 80,000 people a year, and that's another big, huge tourist attraction as well. And people really like the shopping here in Ludington. The unfortunate part is a lot of our stores and some of our restaurants close during the winter months. This would be pretty bustling if this was during our tourist season, which is from Memorial Day to Labor Day. Otherwise, it looks kind of on the deadish side, unfortunately. And Ludington is really a big focus for our tourists. The entire county is around 29,000 people, but about a third of those are actually concentrated within our county seat within Ludington. We do have in Mason County affordable housing shortage, but the big construction boom right now seems to be condo development. If you drive around Ludington, you're going to see a lot of this type of condominium construction taking place. We have two playgrounds that are within Mason County, both of which are in Ludington. One is at Waterfront Park, which is what you see here, and it was built around 1998. We do have another one that's in Stearns Park, and that one is older equipment than the one at Waterfront Park. Now, what's great is we do have a way for people, let's say it's someone that uses a walker, that uses a wheelchair, maybe just has difficulty walking in sand. You can actually walk this boardwalk that will take you across Stearns Park, Stearns Beach, and right up to Lake Michigan. So it allows for persons with all different types of mobility to still be able to enjoy Lake Michigan. So we have one hospital. It's a full-service hospital, has a level 4 emergency room, inpatient facilities, surgical, diagnostic equipment, mammography, all full-service hospital, number of specialists, and that is operated by Spectrum Health conglomerate out of Grand Rapids, which is about 2 hours away from here. We have one urgent care facility. It's operated by another conglomerate, which is Mercy Health out of Muskegon. And we do not have any inpatient mental health or inpatient substance abuse services in Mason County. What we do have are outpatient, which is through West Michigan Community Mental Health Services, and they are also in Ludington. Our population, about a fifth of our population is over the age of 65. The majority of those in our county, it's pretty homogeneous, is white. And if you look to the three counties that surround us, so Manistee, Oceana, and Lake County, we're all very similar. Lake County is different, and if I would say any reason why, it'd be there isn't any big industry in that county until recently, actually. About 5 years ago, their biggest employer closed, which is a corrections facility. They just reopened it in the last year, so that population may rebound now that employer has returned. However, it drastically dropped after that corrections facility had closed. But if you look at the other three counties, we're all about the same. And we have hospitals as a huge employer and or different plants or factories that are big employers within the other three counties. If I was to talk to you about education within Mason County, 11.5% do not graduate high school. However, we have high numbers of those with some college and with associate's degrees. And we're actually above our neighbors' rate, like in Lake County, and we're also above the rate for the state of Michigan. And that could be because we do have a college right in our county. West Shore Community College has more than 30 programs and includes some trade programs like welding. We also have the area's only police academy. So we have an education within our county that if people want to pursue something outside of high school. When I was trying to figure out what direction am I going to go, where's my focus going to be for which type of health promotion or so on, I really needed to prioritize our needs. But I did make my focus a little different for this part than even what I did for my recommended program. But I first had to look at prioritizing needs before I did anything else. So I looked at things like size and gravity of the health concern. Who's it affecting? How many is it affecting? I looked at things like the economic impact. Is it something that can impact industry? Is it something that can impact someone's ability to work? I also looked at things like resources. Do we have the resources in this community to take care of it? And that just doesn't mean just monetarily, but expertise. But also, what are the public health ramifications? What are the concerns associated? But to really focus, I felt like I needed to use the MAP-IT framework for something else. And I really needed to look at what we don't have. And what we don't have is data on persons with disabilities. I talked to Jamie Spoor. Jamie Spoor is a community resident, lives in Mason County. She herself is a paraplegic. She was born with spina bifida. But she's also on some boards that were appointed by our governor, Governor Whitmer, on looking at things like cases where businesses were not really living up to ADA standards of Americans with Disabilities, or not really making the environment as accessible as possible to persons with disabilities. So she gave input how the lack of data. There isn't any data on a local level, as well as when she looks and reviews these cases on a state level, they also have a lack of data that's available. Now, the ACA does not require hospitals that receive funding or public health institutions to really look at disability rates. They have to assess community needs and they have to assess their ability to meet those needs, but not specifically when you're really looking down what type of disabilities, like with Jamie having spina bifida and what her needs are. Is the community able to meet that? And that really is not a requirement. So I looked at how would I get that data? What would I do? And I looked at specifically the first two portions of MAP-IT. So I looked at mobilize and assess. I would look at the partnerships, which we have through District Health Department number 10, which is our public health facilitator or program coordinator. They actually look at, they actually are over 10 counties, not just my county and Mason County, Spectrum Hospital of Ludington, and other community members, as well as Ludington Library, which be able to give some insight on concerns or adaptability issues that they've had with how they can make the library more accessible to their patrons. I also needed to assess and gather data from partners, windshield surveys, and community members. So like when I showed you the survey, the windshield survey showing that yes, obviously we believe there's some need to include and be more inclusive with persons with disabilities because we have the boardwalk that allows people to get to the water's edge. So obviously we're showing there's some need there, but we don't have the numbers to substantiate that. The other three portions of MAP-IT, so plan, implement, and track, would not be done during a typical assessment. That would be in subsequent steps and subsequent programs and committee meetings and so on. Looking at the health profile for the county, more than 60% of county residents are either overweight or obese. And although there was approximately 15% of community health needs assessment or CHNA respondents that said they had not had a physical in last year, it was 75% or more of the same people had said they had their cholesterol checked, a mammogram, a PSA, or a sigmoidoscopy or a colonoscopy done in the last 5 years. So even though they were saying they didn't have a physical, they were still having screening diagnostic testing within the last 5 years. Our biggest concern is cancer within this county. Our rate is 160.4 per 100,000. Second to that is heart disease. And if I was to look at Michigan, it's actually swapped. In Michigan, the first concern is heart disease and the second is cancer. And however, despite that, there's something that came out of that key stakeholders that said they have serious concerns about what we need to attain a healthier vision. And it was something I mentioned earlier, that we need substance abuse services and we need mental health services. And like I said, we do not have any inpatient facilities that is for substance abuse or for mental health. We definitely have very strong assets when it came to public safety. We have a county sheriff's department. We have two smaller police precincts or municipality precincts. We have one in Scottville and Ludington. And if need be, we can get assistance from the state police, which is at a post in the county to our south in Oceana County. We have a full service hospital, and we do have an urgent care facility for those situations that may not need an emergent response. However, like I said, we don't have inpatient facilities like for mental health. We have very strong community support services. So things like that are national, like United Way, Salvation Army. We also have local organizations like HELP or Hands Extended Loving People that provide assistance. But the biggest one that has the impact that even Donna with District Health Department number 10 brought up is with our Ludington Food Club. Ludington Food Club provides food for $10 a month on a point system to those that are in low income within the county. But not only do they provide a means for food, they also provide a means of data for organizations like District Health Department number 10. So that collaboration is important because of the services they offer to the community, but also the information they can provide for additional services or need to other county programs. Our economic development is interesting, going back to what I said at the beginning. Yes, we're a tourist destination, but we're also rural. So it's important that we have a county office for the United States Department of Agriculture. We have a USDA office in Scottville. And why that's important with economic development is they actually help with information like on loans and partnerships for our area farmers and agricultural products, our product producers within the county. So when I looked at my findings, I see, yes, we have lots of social service support. We definitely have organizations that work well with each other. We definitely have education support. We have 3 different areas of public school systems, Eastern, Central, and Ludington, that provide K through 12. We have, of course, the college. We have a couple private institutions and a charter school. But we have a high prevalence of chronic conditions like arthritis. Not shocking, because a fifth of our population is over the age of 65, which also means we're not documenting our disabilities. We're not documenting our disabilities, but yet we have a large aging population, which you would see with, as people age, the likelihood of developing chronic condition goes up. Definite primary health issue would be obesity and being overweight, which is more than 60% of our population within the county, is one of the two. We see a concern with not consuming enough. More than 80% of people within our county do not consume enough fruits and vegetables, and about 20% are inactive. So if I was looking at my assessment particularly and saying, okay, well, what's my strengths and weaknesses of this particular assessment? Well, the one strength definitely is the multiple interviews. I interviewed Donna Nicoli with the health department. I interviewed the director of the library, Eric Smith, which he provided information on, such as, well, that they're what he called a holding site for the homeless population because they can't stay in the shelter during the day. Then I also spoke with Jamie Spohr, who herself is a paraplegic, but she's also been appointed for governing boards by the governor through the state of Michigan. I was able to see that yes, we have a lot of community collaboration. So I could talk to multiple organizations, multiple people, and get wonderful perspectives that actually broaden my data, my hard data, my qualitative data for the county. But what I saw was lack of data on disability and lack of information of who actually is in need. So one of the things I want to focus on was a program on Open Street Event, which would look at people that are overweight and obese, and how we can increase physical activity, fruit and vegetable consumption, but also look at our county collaboration. And by doing that, we could show physical activity, we could show examples for people with disabilities, how they could exercise, and so on. Thank you.